Hey, everybody. Welcome to Resiliency Radio, your go-to podcast for the most cutting-edge insights in integrative and functional medicine. I'm your host, Dr. Jill, and with each episode, we dive into the heart of healing and personal transformation. Join me as I integrate and interview some of the best leaders, thought leaders, innovators, and minds of functional medicine and root cause medicine. Today, we're going to dive into the topic of autoimmune disease. So if you or someone you love has suffered from autoimmune disease or has not found a way to reverse that or find the root cause, you are going to definitely want to stay tuned for this interview. My guest, Dr. Aristo Vojdani, has been a real hero in the world of functional medicine. He has been the innovator in some of the most profoundly innovative labs regarding autoimmune root cause. And you're going to hear all about that and more today on the show. Before we jump into that, I just want to remind you that if you're looking for products or services to help you on your way to optimal health, you can find everything you need at drjillhealth.com. Today, we're going to talk particularly about a funny virus called Epstein-Barr. You may have heard about it, and that reactivation and how it can trigger autoimmune disease. So I want to be sure and mention that you can get our Epstein-Barr bundle at drjillhealth.com. If you want to know more, just pop on over and do a search for EBV, and you'll find that comes right up. Also, if you're looking for a great body lotion to help cellulite and optimal skin, one of our best sellers is back in stock, the Rejuvenating Retinol Body Lotion. You can get that as well at drjillhealth.com. And be sure and check out all the Dr. Jill Beauty products. They are always some of our best sellers and the things that I use myself on my skin. If you don't know where to start with that, go to Dr. Jill Favorites and you can find the 3 products that I don't leave home without. Lastly, if you're looking for someone to help you on your way navigating this journey with autoimmunity, we are accepting new patients at Flatiron Functional Medicine. So give us a call, 303-993-7910, or email info@flatironfunctionalmedicine.com. Okay, let's get on with our show and let me introduce our guest. Dr. Aristo Vojdani obtained his MS PhD in microbiology and clinical immunology from Bar-Ilan University, Israel, his postdoctoral studies in comparative immunology at UCLA and Charles Drew UCLA School of Medicine and Science. He's a clinical professor at Loma Linda University in California, and his ongoing research focuses on the role of environmental triggers in complex disease. He's developed more than 350 antibody assays for the detection of autoimmune disorders, and he's CEO of Immunosciences Lab in California, the Chief Science Officer for Cyrex Labs in Arizona, and on the editorial board of 5 scientific journals. He has won many awards over his lifetime, and he's just a person that you will absolutely love the information he's bringing today. So let's get on with our show with Dr. Vojdani. Dr. Vojdani, it is an absolute delight and pleasure and an honor to have you on Resiliency Radio. I have followed your work and known about you and seen you at conferences for probably 2 decades. And I really appreciated you being such a leader in the research around, especially lab testing on how we determine what dysfunctions of the immune system are causing illness in our patients. And so we're going to dive deep today and answer some questions that a lot of people have. Before we go into some of the questions that I know you're going to give us incredible answers to, can you tell us a little bit about your journey into the work that you're doing now? Like, how did you get here?
My journey in the field of immunology started almost 60 years ago. In particular, when my mother developed rheumatoid arthritis, and due to oral infection, I proved that it was due to oral infection. And then a few years later, ended up with full-blown osteoarthritis that she needed total knee replacement. And so I became more interested in the field of clinical immunology, did my bachelor, master, PhD in the field of immunology, clinical immunology, came to UCLA, did postdoctoral studies. And then, as you know, that I have been in the field of functional medicine, working in the field more than probably 40, 45 years since I did my postdoctoral studies at UCLA. And during one of those meetings, early in I believe, 87, I met Dr. Bland.
Yes.
And that meeting really resulted in my interest in functional medicine. I became part of functional medicine right from the first day. I did participate in the first international, I think, meeting of functional medicine in, I think it was in Maui, in Hawaii.
Yes.
And since then, I could not leave the field.
Yes.
And in particular, during my journey, I was asking, why autoimmunities?
Yes.
And so already I knew about the role of infection in autoimmunities, but not much was known about the role of toxic chemicals that we are exposed on daily basis to these toxic chemicals and their role in induction of autoimmune disease by formation of neoantigen or new antigens. And finally, nobody knew much about the role of food that we eat on daily basis. That if we don't digest the food properly, that food also can turn against us. Actually, our own immune system can turn against us, attacking the food. And then because of some similarity between the food and the human tissue, those antibodies or immune system turn against our body, causing autoimmunity. So infection, toxic chemicals, and foods, all three of them are responsible for induction of autoimmunities. And that's why I wrote a book about the role of food in autoimmunity, because almost everybody uh, doing or measuring IgG antibodies, which I developed that in 1987, by the way. I was the first one to develop the food
Wow.
IgG testing. So they were busy in promoting that you have allergy to this food, allergy to that food. No, IgG doesn't mean
Right.
allergy.
Right.
IgG meaning you have immune reaction.
Yes.
And due to similarity between certain food, example, today we know that milk and brain tissue cross-react with each other. Gluten and cerebellar cross-react. Tomato, soy, corn cross-react with aquaporin in the blood-brain barriers. That's the area I'm interested in. Food association with autoimmunities. So I'd love to talk to you more about
Yes.
this.
Yes. First of all, so exciting. And like I said, having been in the functional medicine field for over 2 decades, I want people out there to know who don't know you yet, how influential you have been to myself and anyone practicing functional medicine. You're right up there with Dr. Bland as far as the amount of information you have disseminated to us as far as this immune connection. So you, again, have been a real leader in this field. Interesting you tell about your mother, because just recently, January 1st, I had a horrible tooth infection, and I went ahead and, of course, extracted it because with my immune system, I knew that it would not stay in my head and a root canal was not going to be good for me. Out of that, I did a biopsy of that tooth, and it grew 12 things, including Porphyria gingivalis and many of the known autoimmune triggers, including Bartonella, right? It
Yes,
was amazing to me to see that list of severe pathogens. And literally, in those 4 weeks of recovery from surgery, my labs shifted, my body changed. And I knew, just like in your mother's case, that had I left that in my body, very likely I would have had sequelae down the road. And I was already looking back, that probably was infected in my mouth for 18 months or so before it started manifesting. And it just goes to show that something like a toothache can be
yes,
so profound for brain health or for other autoimmune. And how interesting that that's how your journey started with your mother, and realizing, and even now, I'm not a dentist, but every single patient that I see, I'm asking about the oral microbiome and the teeth because it matters.
yes. I'll add a little bit more to that.
Okay.
But before that, let me say something to your listeners and the one who will watch this program.
Yes, yes.
I want you to know that when Dr. Jill speaks in different meetings, 500 people, 1,000 people, all doctors, researchers, everybody listens.
Oh,
And thank you for your contribution to the field of medicine, especially functional medicine. So
oh,
in 1968, 69, I was doing my master's degree. I wanted to prove the connection between Performance gingivalis and other oral pathogens
yes.
in relation to my mother's sickness.
Mm-hmm.
So I took blood from her and from her friends who were healthy.
Yeah.
At that time, I measured antibodies in her blood against Performance gingivalis and strep.
Yes.
Yeah,
Gingivalis. Mm-hmm.
yes. And I found 1,000 times more antibodies in
Wow.
my mother's blood compared to her healthy friends. And that's when, in 1968, I connected the dots between
Yes.
oral infection and full-blown rheumatoid arthritis. And today we know the
Yes.
mechanism even is clear. The toxin which is released overactivate the immune system, release of inflammatory cytokines, release of lipopolysaccharides, from different bacteria. All of that goes to the joints, and immune attack against all those bacterial antigens
Yeah.
after years result in destruction of joints and full-blown rheumatoid arthritis.
Mm. So interesting. I just love that story and how beautiful it is. The other thing I want to say about you publicly too is your son now teaches with you, and what I've seen with how you are in the world is you're so respectful and loving and honorable to your family and bringing that in. And to me, it adds a whole nother depth of who you are as a human being. And it's truly beautiful to watch when you and your son lecture together and to see him up there doing all the work that he does. It's just a side note, as a human being, you're an incredible human as well as a researcher. And I,
Thank you so much. I
yeah,
really appreciate
yeah,
from the bottom of my heart.
yeah.
Thank you. Thank you.
So let's go on. For those who are listening, we have a lot of doctors who listen. We have a lot of just general, patients who listen. But for those who maybe don't understand the concept of molecular mimicry, that's at the heart of what you're talking about. And it can be toxins or infections. Do you want to kind of talk about what does this molecular mimicry, how does it happen?
Okay, beautiful. So viruses and other pathogens, they have been in this world millions of years before us, right?
Mhm.
So during these thousands and thousands of years and their communication with human immune system, they tried to change their structure
Yeah.
to look like human components, human tissue.
Mhm.
And for doing that, in order to hide from the immune system, they changed their structure to look like human tissue. We call that molecular mimicry or epitope similarity between pathogens with human tissue. Why that is so important? First of all, autoimmunity. Autoimmunity, immunity against self. When I participated or I took my first class in immunology, the professor in the first hour presented that the immune system can differentiate between self and non-self. Self being all these tissue components, the cells, their proteins, their peptides, and non-self meaning the parasites, viruses, bacteria, all of that non-self. So the immune system in the first few months learns how to differentiate between self versus non-self. So learn to attack the bacteria and viruses and
Yes.
protect us against infections, and learn not to attack the self tissue. When this equation becomes broken, and immune system cannot differentiate between self and non-self, results in immune reaction against self. We
Yes.
call that autoimmunity. But the question we are asking, why the immune system loses its capacity to differentiate between self and non-self. There are several mechanisms. One of them is molecular mimicry, as you mentioned. Molecular mimicry is when the infections change their structure to look like human, meaning several amino acids. We call that peptides.
Yes.
Which almost identical to human peptides, and therefore immune system is confused.
Yes.
The immune system doesn't know to attack or not to attack. When it looks like not self or non-self, will attack that.
Mm-hmm.
Classical example is SARS-CoV-2.
Yes.
And I'll give another example, EBV or HHV6, which are all three of them involved in long COVID.
Yes.
So when I started my research with SARS-CoV-2 as early as in 2020, it was about April 2020, when the first lateral flow test, yes or no, became available.
Yes.
When I did the first 100 antibody testing and found, let's say, 60 of them were positive for SARS-CoV-2,
Mm-hmm.
immediately came to my mind that similar to EBV and HHV6 that I knew about their role in autoimmunity, I said, oh my God, I have all these kits
Yes.
in the laboratory. Let's measure biomarkers of autoimmunity in these 60 individuals who made antibodies against SARS-CoV-2. We found majority of them
Mm-hmm.
had elevation in biomarkers of autoimmunity,
Mm-hmm.
such as anti-nuclear antibody, which is the best screening for autoimmunity. ENA, which is extractable nuclear antigen. Double-stranded DNA. Again, think about, we are attacking our own DNA.
Right.
Okay. And rheumatoid factor. What is rheumatoid factor? When our IgG becomes aggregated, and then we'll ask why IgG becomes aggregated, the immune system attacks aggregated IgG. We call that rheumatoid factor.
Mm-hmm.
Mitochondrial antibodies, especially, we found to be elevated. Actin antibody. So we demonstrated immediately. I wrote an article, one-page article in Journal of Clinical Immunology, which was published almost the next few days after that,
Mm-hmm.
that elevated biomarkers of autoimmunity are detected in patients with SARS-CoV-2. So that was the first step.
Mm-hmm.
The second step, when we took serum from these patients, for example, had mitochondrial antibodies, reacted with SARS-CoV-2 antigens, reacted with that.
Mm.
And isn't that due to
Yes.
cross-reactivity?
Right.
That's negative. Then I took monoclonal antibodies when became available, made against SARS-CoV-2, reacted that to 60 different tissues.
Wow.
26 of them became reactive. And among those, I will mention few.
Yes.
Thyroid peroxidase thyroglobulin reacted with antibody made against SARS-CoV-2. Tight junction proteins, occludin zonulin, reacted with that. Brain tissue reacted with that. Even transglutaminase in the gut reacted with that antibody. So that was the third way of showing cross-reactivity. But the next one, which was done by myself and many other scientists in the world, looking at epitope sharing. There is a program, you can go online and take 10 or 20 amino acids from spike protein. And ask, what is the similarity between these 20 amino acids or 10 amino acids with tissue antigens? And you get the answer.
Wow.
And we found many, many of these which, published. So this is really the answer to your question. Mimicry or cross-reactivity actually is epitope similarity, few amino acids from bacteria or virus or parasite looks exactly like human, when we attack that parasite or virus or bacteria, then the immune system attacks our own tissue.
Mm. So
So
you're
this
saying,
is
oh, go ahead.
so because the reason I mentioned all of these four, because it is not enough to have just epitope similarities.
Right.
You have to do all those different experiments in order to show real involvement of different pathogens and their peptides and antigens in induction of autoimmunities. Allow me give you another example.
Yes.
Okay, so individual get infected with HHV6. Somehow, human herpes type 6 get into the thyroid tissue. I don't know how.
Yeah.
Okay, maybe through the blood or broken, I don't know, thyroid barriers. I don't know. Okay, let's call it thyroid barriers. The virus can get into the thyroid.
Yes.
The virus binds to thyroid tissue antigens. What is the job of natural killer cells? I did many research with natural killer cells. They're very simple. Natural killer cell job is to destroy viral infected cells.
Yes.
Secondly, to destroy cancer cells.
Mm-hmm.
So now imagine that the virus, HHV6 or EBV,
Yes.
is bound to thyroid tissue. The natural killer cells now, like Pac-Man, destroying the tissue.
Yes.
What is going to be released? Thyroid peroxidase
Yes.
and thyroglobulin and many other tissue antigens. That's how our body produces antibodies against thyroid peroxidase and thyroglobulin. So I wanted to elaborate to you, your viewers, a little bit more than me, because you are very good in expressing this. So the message is, if we can take care of, if we will find first the trigger, in this case, trigger of autoimmunity, such as thyroid autoimmunity, and take care of EBV or HHV6
Yes.
based on a blood test that we
Right.
do in the laboratory, then you can make huge difference in this world and preventing full-blown autoimmune disease such as thyroid autoimmunity based on molecular, not just molecular mimicry.
Right.
This is the virus is causing the immune system to attack our own self tissue. So this is another mechanism.
Hey guys, just a very short interruption to remind you that if you or someone you love is suffering from complex chronic illness or autoimmunity, Flatiron Functional Medicine, my clinic in Louisville, Colorado, we are accepting new patients. All you have to do is call 303-993-7910 to get more information or see if it's a good fit for you. Both of my mid-level providers, Hannah and Fawn, are fantastic with complex chronic illness. I go over all the cases with them, so I'm involved. You can also email info@flatironfunctionalmedicine.com if that's easier. And if you're one of those that's suffering from autoimmunity or Epstein-Barr reactivation, we do have an incredible, successful, popular Epstein-Barr bundle you can purchase yourself at drjillhealth.com. Again, just go to drjillhealth.com and click on Epstein-Barr bundle and take a look. Okay, let's get back to our show. This makes so much sense. And just for those listening, I want to just reiterate what Dr. Vojdani said in that, and we've always known adrenal thyroid, we can find like Epstein-Barr virus, and you're saying HHV6 as well. So these viruses can literally integrate into the tissue. We know this from biopsies of postmortem on tissues. And Amy Prowl is doing at Polybiomed, I believe is her research company, biopsies of postmortem COVID and finding the spike protein integrated in nearly every tissue that she tests, the brain and the lung and the prostate. So we know what happens in this is this integration of the viral material into something like the thyroid. And then we test, and because the body is trying to natural killer cells attack the thyroid, we get thyroid antibodies, which for those of you listening would be Hashimoto's thyroiditis, which is super prevalent in the world. And again, these other autoimmune diseases. What is the autoimmunity is on the rise for sure. And you're just explaining to everybody listening why we're seeing such a big increase in incidence. Have you seen statistics on the rise in autoimmunity and how it's related to all this?
Yes.
Yeah.
Yes. Absolutely. So just let me add a little bit more
Yes.
to what you said.
Mhm.
Indeed, they took needle biopsy
Yes.
from patients with Hashimoto's thyroiditis.
Mhm.
82% found DNA of HHV6.
Wow.
Yes,
Wow.
82%.
And I
So
remember seeing some studies on Epstein-Barr prior to recently, because I know that there's a huge correlation, even post-COVID, long COVID, with this HHV6 and Epstein-Barr and the association with chronic fatigue and ME/CFS, and you can talk about
absolutely,
that. But so
absolutely.
you're saying 80% of someone who has thyroiditis, biopsy proven, the HHV6 was present in the thyroid gland and integrated into the tissue, really, right?
Yeah. While I'm talking to you, I want you to show you that there are lots of articles
Yes.
just sitting right in front of me. And a couple of those articles are about biopsy taken from
Yes.
patients with thyroid autoimmunity. Furthermore, human herpes type 6 and EBV have similar epitopes
Hmm.
with brain tissue antigens. And that's why also HHV6 and EBV is found in the brain of patients with multiple sclerosis.
Yeah.
So the simple kissing disease
Yes.
that
Yes.
that such which is Epstein-Barr virus is responsible to that could end up with severe disease
Yes.
like multiple sclerosis. In fact, in some articles I read that Epstein-Barr virus infection is prerequisite for induction of severe autoimmune disease such as multiple sclerosis. So let's talk about rise of autoimmunity. So number one, let's establish that change in the structure of bacteria, viruses, parasites by itself contributes to induction of autoimmunities. But then you can ask me, well, these viruses have been there for years, thousands, millions of years. What changes occurred? That I really don't know how to answer that. But yes, I don't know, maybe our environment, the number of chemicals in the world may change the behavior of these viruses and bacteria. That's one explanation.
Mhm.
But the evidence for rise of autoimmunity comes from very interesting article published by Dr. Miller from National Institutes of Environmental Health. I think it's in North Carolina.
Mhm.
He looked at just simple anti-nuclear antibody. 20, 30, 40 years ago, I was reading lots of articles about that. Between 2 to 4% of the general population are positive for anti-nuclear antibodies. And they call that normal, but I don't call that normal.
Right.
Those are the patients who are brewing autoimmunity,
Yes.
but that percentage was 2 to 4%.
Did you coin the term predictive autoimmunity? Because I think this goes back to
Yes,
some of the,
yes,
right? So
yes,
this is what we're
yes.
talking about is as a clinician for me in functional medicine, I don't want to wait until someone develops lupus or MS. I'm actually over here on that trajectory testing these through some of the tests that you designed to say, is someone walking towards autoimmunity and can we predict and change their course? Do you want to talk a little bit about that?
Yeah.
Predictive?
In fact, when I did the first study with SARS-CoV-2, the level of antibodies against ANA, ENA, dsDNA were really borderline elevation.
Yeah.
If rheumatoid factor 6 is the normal, they had level of 8, 10,
Mhm.
15, 20, not 300
Yeah.
or 600 that we find in patients with full-blown rheumatoid arthritis. The same thing, many other biomarkers. So we call that predictive
Mhm.
antibodies that are detected many years before the full onset of autoimmunity. By taking that seriously, we can do something about
Yeah.
by finding the triggers, remove the triggers, and those antibodies will disappear. Uh, in fact, an article was published in Journal of Autoimmune Disease in 2016 or 18 that looked at early detection of antibodies in patients with autoimmune diseases, found that in some, these antibodies, after detection, the antibodies takes 3 years to develop autoimmune disease, some 7 years, some 18 years.
Wow.
So isn't that a window of opportunity for
Yes.
intervention? So you and I, we understand
Yes.
that the value of predictive antibodies. Why? Because we can find the trigger and remove it and prevent autoimmune disease in the future. But unfortunately, the rheumatologists, the others, those who are specializing in autoimmunity, they will say, well, rheumatoid factor of 8 or 6 or 10 or 20 is nothing, non-significant. Go home, come back next year. That is the biggest mistake. I'm sorry
Yes.
to say that.
Yes, I couldn't agree more. And then post-COVID, what we were seeing, I'm assuming this might have been one you were checking, but anti-cardiolipin, which is again a part of the inner cell a membrane, was super high relative, and that can be a marker for lupus. And so I was often checking that among other antibodies in these post-COVID patients, because again, I knew if I saw that positive or weakly positive, they're on this trajectory. Let's go back to something you mentioned, and that's like this exposome. You've talked a lot about that in your lectures, and because I do all this environmental medicine and mold toxicity with my patients, they know that I talk a lot about that. But we have toxic chemicals, we have food, we have infections. Do you want to go through, because all of those can be exposome, just maybe say what is the exposome, and then how can all of these things, if we're looking for root cause, be triggers for autoimmunity?
Yes, absolutely. I wrote 2 articles in a journal called Pathophysiology. These articles were about pathophysiology of autoimmune diseases
Mhm.
and explained the issue of the exposome factors. The definition actually is the internal and the external factors that together contributing to autoimmune and other inflammatory diseases. We talked already about the pathogens.
Yeah.
But one of my favorite ones, which, not because of I like them, because I am very much chemical sensitive, and part of also my life that I got involved in the role of environmental factors in autoimmunity, particularly the toxic chemicals. I don't know, let's take a few examples. You know definitely what are forever chemicals.
Yeah, polyfluorinated compounds is one of them.
There are 10,000
Yeah.
of them.
Hmm.
Recently, the movie that made about in somewhere in um, Atlanta, in
Hmm.
Georgia, the carpet factories
Yes.
who use a lot of forever chemicals, PFAS.
Hmm.
And now the rivers are contaminated with
Yes.
these chemicals. So when the cows and other animals drinking the water, a week later they die
Mm.
due to exposure to these chemicals.
Wow.
For me as an immunologist, the meaning of forever chemical is this, that chemicals, whether it's from Teflon or carpet or other sources, when they get into our blood,
Hmm.
bind to the highest protein that we have in our blood. Number one is albumin.
Yes.
Second one is immunoglobulin,
Yes.
IgG. So you remember I mentioned rheumatoid factor is
Yes.
aggregated IgG. So isn't that chemical is going to aggregate
Yes.
the IgG and then becomes rheumatoid factor?
Wow.
When chemicals bind to albumin, now our body is going to attack. That's really the mechanism of breakdown in recognition of self versus non-self.
Right.
So they are going to attack this new antigen they never seen before.
Yes.
And that's another mechanism of autoimmunity.
And you're saying that aggregated IgG, we know antigen antibody complexes are like this immunoglobulin, which just got Y, and it may have a predisposition towards wheat or towards a cross reaction to thyroid. And you're saying as they conglomerate and make these complexes, immune antigen complexes, that's what the rheumatoid factor is actually attacking. Is that true? Or did I have that?
The rheumatoid factor becomes immune complexes.
Got it.
Right,
Yeah.
correct.
Okay.
Now they have to go to liver.
Mm-hmm.
The liver has certain capacity. If the Kupffer cells of the liver can remove
Mm-hmm. Complex.
the complexes, which by the way, they're part of the tolerance mechanism.
Mm-hmm.
Certain level they can remove
Yeah.
the complexes. When they cannot remove all the complexes, they go where? To the joints,
Yes.
into the kidney,
Mm-hmm.
resulting in lupus,
Yes.
arthritis, and other inflammatory disorders. So neoantigen formation, in my opinion, there are more contributors to autoimmunity than just the pathogens.
Yes.
Now, in relation to food, how many chemicals we have in our food?
Yeah.
I use this example. Let's take peanut butter or peanut protein. There is a lot of aflatoxin,
Yes.
mycotoxin
Right.
in peanuts. Aflatoxin binds covalently to peanut protein and for neoantigen
Yes.
in the peanuts. During childhood, we already have tolerance against peanut protein, other proteins that we consume on
Mhm.
daily basis. That's how the oral tolerance mechanism works.
Yes.
But when the aflatoxin or other chemicals manage to bind to the body, to the food, in this case, I'm sorry, the peanut
Mhm.
proteins or other food proteins, the tolerance mechanism breaks down
Yes.
and they react against the combination.
Yes.
So the antibody now, plus the not being able to digest,
Right.
because our digestive enzymes know how to digest pure
Peanut, but not
peanut
peanut
protein,
plus. And the
right?
same thing with Stephanie Seneffsworth with wheat is often used to glyphosate, and there's a combination of that chemical, which
Exactly.
is Roundup in wheat, and our body doesn't know, which is why there's a huge rise in celiac and anti-gliadin antibodies, because again, we know how to break down gluten for the most part, some of us, but
Exactly.
this combination
Exactly.
of a chemical with a food, which what you're saying is there is so much increase in the chemical in the food. And we didn't even get to plastics. I just did an interview with Lynn Patrick a few weeks ago, and she's talking about 90% of the plastic exposure is not micro, it's nanoplastics, which is less than 2.5 microns. So there's no barrier in our body that can prevent these nanoplastics at that tiny, tiny size. It goes directly into the brain tissue and the thyroid tissue, into the. So once again, it's like the plastic in the body is creating this new antigen that you're describing, right? And then we have this
Yeah,
autoimmune process.
absolutely. I'm glad you mentioned that.
Hmm.
So we gave just two examples,
Hmm.
glyphosate
Yeah.
and aflatoxin, but
Aflatoxin.
there are thousands and thousands of additional chemicals acting exactly what we
Yes.
both of us mentioned.
Yeah.
But plastic is one of my favorite
Yeah.
subject, which I hate
Me too.
because, because because really, if you take a plastic bottle, which many individuals drinking water from,
Right.
just go online and ask how many toxic chemicals, not chemicals, because water is a chemical.
Right.
How many toxic chemicals are in the plastic bottle? The answer will be about 15
Wow.
major toxic chemicals, including endocrine disruptors.
Hmm.
So if you are a boy drinking every day
Yes.
water from plastic bottles, those toxic chemicals is going to destroy your testosterone
Yes.
because it's competing with that.
Hmm.
And if you are a female, it's going to compete with your estrogen and progesterone.
Yes.
So So they are very serious chemicals. At the same time, also can bind to human tissue, formation of neoantigens. And there are hundreds of articles I have in my position that possession
Yeah.
that talks about nanoparticles and in the brain,
Right.
not only in every single tissue in the brain. They did one simple experiment also. This is for those who love to drink from plastic bottle. They put the plastic bottle in a dishwasher
Hmm.
and they collected the water. They collected, I think, 350 more chemicals.
Wow.
And in every single bottle, they found, I believe, 250,000 nanoparticles.
Wow.
So imagine every day you are drinking
Yeah.
that. What will happen to all these nanoparticles?
Yeah, it's so important. In fact, after I really am very careful about my environment. I practice everything I tell my patients. However, I happen to really like Pellegrino. And I do get glass bottles, but sometimes the smaller plastic bottles are easier. And up until that interview with Lynn Patrick, I was still using those a couple times a week. After that interview, I switched to completely glass. I don't care how big they are. And I just thought I cannot be drinking out of plastic bottles. And I just say that to give hope to those out there because even me who really tries to follow what I give advice for, it's hard. You have to be very deliberate because once these things are in your system, we don't have a binder for plastics. I think like that's why
Yes,
plasma exchange is becoming so much more popular because we really don't have like charcoal's not going to pull out plastics. Um, so,
correct,
so we have to
correct.
really be more creative and be more aware of exposures. Um, I want to stick to the gut because gut,
Let me add
yeah,
something
please,
more,
please.
and
Yeah.
then, but sorry,
Yes.
apologize.
No, perfect.
I have some unpublished data.
Uh-huh.
Even if I will not be able to publish it, I want you to,
Yes.
our
Please.
program will be this will be evidence for the future
Yes.
that almost more than 50% of people who I took their blood
Yeah.
reacted to plastic nanoparticles.
Wow.
This is huge.
This is huge. More than
It's
50%.
unpublished. It's unpublished, but hopefully one day I'll have enough time
Yeah.
among all so many things that we do every
Right.
day. I'll be able to publish that. So please go ahead.
Okay, no, just so to reiterate that, so over 50% of those you tested were reactive to nanoparticulate plastic. And I'm assuming once again, it's because it's so small, it's integrated into tissue, into DNA, into cells, so that it's once again very likely a big trigger for autoimmune disease. And the difficulty is, for those of you listening, we don't really have a great mechanism yet to pull that plastic out of our body. Like maybe metals, we have some binders and EDTA, but again, this is all new. And then with Lynn Patrick's interview, we also talked about how making the plastic, they use tin, a lot of the heavy metals are in there. So it's not just the plastic, it's the contamination of the plastic. So it is a whole new world out there with how big of a deal that is going to be in our bodies.
Yes,
Yeah.
absolutely.
Okay, so gut. So let's talk about gut. And I want to tell a little story because I think you'll relate to this. It's kind of like your mother and my tooth and everything else. I had cancer at 25, and because of the aggressiveness of it, I had 3-drug chemotherapy, got treated, and went into remission at 26. But in that 3-drug chemotherapy, I had some very heavy drugs, including Cytoxin, which is known to act by creating more permeability in the gut. So you know where I'm going with this because 6 months after my treatment with chemotherapy, I developed Crohn's disease. And it makes perfect sense to me because all of a sudden I opened up those tight junctions wide open with the chemo drug. I had undiagnosed celiac. I was on a gluten-full diet and I had all of this stuff contributing. And then that leaked in the LPS, the bacterial coatings from the gut. And I believe that my Crohn's was a result of that flooding the bloodstream with all of these antigens from the gut and the permeability and all of that. And then the Crohn's is just like you talked about tissues, this aggressive T cell reaction on the surface of the gut that caused damage that was the appearance of Crohn's. Now, fortunately, by healing the gut, healing the membrane, taking out the foods that were triggers, I no longer have Crohn's. But do you want to talk a little bit about that story in relation to the gut and intestinal permeability and how foods can actually trigger autoimmune disease too?
Yeah, definitely. Um, in those two articles about exposome, I have a figure showing that genes plus environmental factors, food,
Yeah.
toxic chemicals, and pathogens, their effect on gut bacteria and change in the microbiome and mycobiome
Mhm.
results in breakdown in the tight junction proteins, unwanted antigens, including the LPS and other antigens from the gut, plus whatever it comes from the food, the combination of chemicals plus the food antigens get into the blood. We react to all of that. And the antibodies now made against all of these are going to attack
Mhm.
our blood-brain barriers. Now blood-brain barriers are open and not only resulting in inflammation and neuroinflammation, but autoimmunity and neuroautoimmunity. So definitely the gut is a major component of autoimmunity and breakdown in our biological doors.
Mhm.
The gut and blood-brain barriers are responsible for induction of many autoimmune diseases. In fact, in one of the articles that I wrote with Dr. Maz,
Yes.
which originally he published an article about LPS antibodies uh, in patient with schizophrenia and MECFS
Mhm.
in around 1990s. And now we became friends, and we, in the past 10 years, we worked together and published together. We wrote probably 8 different articles together. One of them was in patient with long COVID.
Mhm.
They make antibodies against tight junctions, occludin zonulin, lipopolysaccharides,
Yeah.
but also at the same time makes antibodies against myelin basic protein, myelin oligodendrocyte glycoprotein, alpha beta crystalline, proteolipid protein,
Wow.
synapsin, cerebellar,
Wow.
alpha beta tubulin, and many, many more, which all of them are involved
Mhm.
in the pathophysiology of multiple sclerosis and other neuroautoimmune disorders.
Yes.
So yes, the gut and breakdown in the tight junctions is responsible for induction of many inflammatory, autoimmune, and neuroimmune disorders.
Mhm. Well, you mentioned long COVID, and I want to kind of maybe end on that topic because you've just done a lot of research in the last 5 or 6 years on long COVID. I think there's about 10 to 20% of the population post-COVID that have, so it's a very large percent of the population that have symptoms, and you've already elucidated some of those mechanisms. Do you feel like the SARS-CoV-2 virus is maybe more antigenic than ever even we knew about Epstein-Barr and H? Like, do you feel like it's the most threat or trigger of anything we've seen in the past?
I 100% I believe
Yeah.
that about super antigens.
Mm-hmm.
And you know, we are familiar with super antigen with Staphylococcus,
Yes.
Streptococcus, they call it, which cause toxic shock syndrome.
Mm-hmm. Yes.
It is due to super antigens.
Okay.
What are the super antigens? Super antigens are antigens released by viruses and bacteria, which push the immune system into overdrive. That's a good way to put it,
Yeah.
right? Overdrive of the
Mm-hmm.
immune system. So in the case of long COVID, infection with SARS-CoV-2,
Yes.
and which usually this should disappear, the immune reaction against that for
Right.
2 weeks, 4 weeks, 8 weeks. But sometimes the virus itself or its remnants stay in the body.
Yes.
This is published in my article in Viruses.
Mm-hmm.
They activate the latent viruses. Which one? EBV and HHV6, and to some degree even cytomegalovirus, which we have seen these 30 years ago in patients with chronic fatigue fibromyalgia.
Yes.
So the EBV, HHV6, and SARS-CoV-2, they have also super antigens, especially SARS-CoV-2.
Mm-hmm.
This is published. And the vaccine
Yes.
contains super antigen.
Mm-hmm.
What is the job of super antigens? Overactivation of the immune system, right? So SARS-CoV-2, reactivation of latent viruses, release of super antigens, superactivation of the immune system, breakdown in the gut microbiome and the tight junctions, or imbalance of microbiome, and breakdown in tight junctions. Then activation of oxidative stress response, mitochondrial dysfunction.
Yes.
Then autoimmunity, including autoimmunity in the brain. That's the end result. This is really the mechanism of these three viruses. And that's why about 2 years ago, we called them the autoimmune trio.
Yes.
SARS-CoV-2, number one.
Yep.
Followed by EBV and HHV6.
That makes
And
sense.
that's why we have a test. We call that the viral trio. We measure antibodies against this. And those plus doing or measuring antibodies or biomarkers of autoimmunity, we call that long COVID panel. However, in relation to long COVID, our articles, plus many other published articles, we show that long COVID ends in the brain.
Yes.
And again, back to your question of molecular mimicry. Okay, so SARS-CoV-2 has a nucleoprotein cross-react with myelin proteolipid protein, which is a target of multiple, in multiple sclerosis, target tissue in multiple sclerosis. That's one article in here. HHV6 cross-react with MOG, meaning myelin oligodendrocyte glycoprotein and myelin basic protein. Very well established.
Yes.
Then EBV cross-reacts with alpha beta crystalline, which is heat shock protein of the brain.
Yeah.
Cross-react with myelin oligodendrocyte glycoprotein, and also Epstein-Barr nuclear antigen. Cross-react with glial CAM.
Wow.
Glial cell adhesion molecule.
Wow.
So these are articles published in Nature, in Journal of Clinical Virology, and many other very reputable journals. So all of these contributes, unfortunately, to long COVID. But the message that today we have, if we can find the triggers, if it's EBV or HHV6,
yes,
or CMV or SARS-CoV-2, I know from many practitioners like yourself, my son Elroy,
yes,
and many others, that when EBV HHV6 is involved, you can do something about it.
yes.
You can give them peptides.
Mm-hmm.
You can give them naltrexone, low dose.
Yes.
You can give them low or high doses of vitamin C,
Mm-hmm.
which I already published many years ago.
Yes.
How much vitamin C can activate natural killer cells. The natural killer cells, although we learn from the thyroid autoimmunity, but their job is to destroy
Yes.
the viruses, such as EBV and HHV6. So the message is really, if you look at these biomarkers of long COVID,
yes,
and you find the patient having antibodies against, for example, early antigen,
mm-hmm.
which shows reactivation of latent viruses, or another biomarker that we found called DUTPase.
Mm-hmm.
It's an enzyme that expressed in EBV and HHV6 during latent reactivation of viruses. The antibody against that tells us that go after the EBV, go after the HHV6, and then hopefully you can change the life of your patient with chronic fatigue, fibromyalgia. Today it's called MECFS,
yes,
or long COVID.
yes.
Overlap with each other.
Mm-hmm. Amazing how you put that all together, and you have published so many papers. We will make sure, if you're listening, that include all of the major works that you cited in the show notes. So if people want to know more, want to read more, there's a lot. I've read many of those articles, and they're so profound and insightful for me as a clinician. I want to end by making sure people know that you have developed some of the cutting edge labs in functional medicine, and if people want to know more, because I use these labs every day. You mentioned the new long COVID panel. There's many others I've used for a long time. Do you want to talk just a little bit about those, the kind of panels you've developed that we can test and find these things that maybe most
Yeah.
relevant?
First of all, the suggestion that I'm going to make, I'm making it to my own family
Mhm.
members.
Yeah.
Please do autoimmune screen
Yes.
every year,
Hmm.
which includes anti-nuclear antibody, ENA, dsDNA, rheumatoid factor. So if that is positive, try, based on predictive antibodies, try to find the triggers and stop development of autoimmune disease.
Hmm.
Among those factors are viruses. That's why we have a panel called Viral Panel Comprehensive. We look at EBV, CMV, HSV1, HSV2, uh, uh, even measles and other viral antibodies. That can guide us which viruses
Yes.
are involved. Uh, in the case of viral trio, which are involved
Yes.
with long COVID, please look at possibility of that these three viruses, SARS-CoV-2, EBV, and HHV6, and their contribution to
Yes.
autoimmunity, including long COVID. And finally, we have long COVID and the brain,
Hmm.
because based on the same cross-reactivity mechanisms, not only we measure antibodies against these three viruses and the autoimmune panel, we are looking at biomarkers of brain, such as myelin oligodendrocytes, myelin basic protein, proteolipid protein, and glial cam, which all of them cross-react either with EBV or with HHV6.
Wow.
So again, if the patient makes antibodies against some of these factors, viruses, brain tissue, human tissue, based on those, we can take preventive measures and prevent many autoimmune diseases, including neuroautoimmune disorders and maybe even neurodegenerative
Right.
disorders such as Alzheimer's disease.
Mm.
So predictive antibody is the name of the game
Yes.
that can help you to detect at early stage and prevents many inflammatory and autoimmune disorders in the future.
Absolutely amazing. This was so full of insights and, as always, your wisdom. And most of all, just thank you for making such a difference in our field, because the types of testing that you have created really allows me as a clinician, your son, and everybody else in our field to do the work. We couldn't do it without that, because then we know what the targets are. So my deepest gratitude to you for your brilliance and your work in the world. It's really profound.
Yeah, thank you. I'm really taking pride in this, that my job is assay development.
Yes.
And all of that was based on the connection, the dot that I connected between my mother's health,
Yeah.
that, the oral pathogens, and I developed an antibody. There wasn't any method at that time. I developed that method to measure my own mother's blood to connect the dot between oral pathogen versus uh, her health, as which developed rheumatoid arthritis. So I was gifted, and probably someone helped me
Right.
to develop all these
Uh,
methodologies for early detection of autoimmune diseases. And I'm honored that to be part of this world, that I can help uh, early detection of autoimmune diseases and prevention of those. This is part of my contribution to this world, that I'm part of it.
It's a big one.
And
And we also, I just love that your mother, like we owe her a deep debt of gratitude to how beautiful that gift in a way that she gave you because it really has transformed functional medicine. Dr. Vojdani, thank you as
thank you.
always. It's been
My
a pleasure.
pleasure.
Hey guys, thank you for listening to that incredible interview with Dr. Vojdani. He has been a leader in our field, and you can tell just a humble, incredible scientist who's brought so much incredible information to us as practitioners in order to find the root cause of complex chronic illness and reverse it. So I hope you enjoyed that interview. Please do share with your doctor, your friends, your colleagues, anyone suffering from autoimmune disease. And we mentioned Epstein-Barr. I didn't talk about it in the interview, but we do have an Epstein-Barr bundle at drjillhealth.com that's been highly effective for those of you who might be suffering from autoimmune related disease related to Epstein-Barr. You can go to drjillhealth.com and find the Epstein-Barr bundle and take a look and see if that might work for you if you want more information. Anyway, I look forward to seeing you again next week for another new episode of Resiliency Radio. If you haven't yet clicked like or subscribe wherever you're listening to this, that helps us reach more people. And I look forward to seeing you next week for a new episode.